In this lecture, we will discuss about other key issues across vulnerable groups in the time of COVID-19. Moral injury. It can be defined as the damage done to one's conscience or moral compass when that person perpetrates, witnesses, or fails to prevent acts that transgress one's own moral beliefs, values, or ethical codes of conduct. It is the social, psychological, and spiritual harm that arises from a betrayal of one's core values such as justice, fairness, and loyalty. Now, we will discuss about moral injury in healthcare workers. There have been cases where the frontline workers in the pandemic, especially the health professionals, have been facing moral injury. The healthcare workers have been facing high risk of moral distress during the pandemic. The reasons for it are many, including rapid changes in the clinical practice and procedures of resources during the time. Tensions are experienced between the needs of individual patients versus the needs of the community, patient-centered care versus the common good and patient preference versus fair resource distribution. Due to the scarcity of resources and infrastructure, healthcare workers have been compelled to make clinical decisions that are not consistent with therapeutic morals and ethics. It may take a significant emotional toll on the healthcare professional by knowing of the fact that one patient will receive life-sustaining treatment support while other will be denied for the same treatment. The human factor has traditionally been missing in scarce resource allocation business models. It is critical that choices are made while balancing the needs of the patients with system constraints and adopted protocols. There is a psychological cost of making such crucial life versus death decisions, which can profound have the impact on the individuals involved. Hence, it has become essential to monitor mental health of frontline workers and to provide them with social and psychological support. Now, we will discuss the risk factors in development of moral injury. There is a high risk of moral injury if this is treated as a loss of life to a vulnerable person, example child, women, or elderly. Moral injury can also occur if leaders of the organization are perceived to not take responsibility for the events and are unsupportive of their staff. There is a high risk of moral injury if staff feels unaware or unprepared for emotional or psychological consequences of the decisions taken in their work. There is also risk of moral injury if the morally injurious experiences occur simultaneously with exposure to other traumatic events in the frontline workers. Lack of social support is also a contributing factor in the development of moral injury. Moral injury is not an illness. However, there are feelings or symptoms that may result from moral injury, which include feelings of guilt, distrust, negative self-talk, loss of meaning and purpose, anger, shame, and a sense of betrayal. Now, we will discuss about moral injury and psychological disorders. Moral injury is not a real illness, but if left untreated or unacknowledged, it may lead to development of mental illness such as depression, anxiety, post-traumatic stress disorder, etc. It may also cause other emotional and behavioral disturbances such as psychological and behavioral manifestations, which may include self-isolation, hypervigilance, avoidance of certain people or situation, difficulties in social life, drastic changes in world perspective, compulsive behaviors, intrusive memories, feeling demoralized, difficulties in attention and concentrating, self-harming tendencies. Now, we will discuss about moral injury in other frontline workers. Moral injury may occur in not just health professionals but other frontline workers as well, like emergency first responders and other non-healthcare related staff, like social workers, prison staff, etc. Due to lack of resources, workers are not able to take care of those they are responsible for, which finally results in great suffering or loss of life. Lack of resources, clear guidance, or training also gives a message to the staff that their own health is not being properly considered by their employers and they may feel themselves at an increased risk of disease exposure. Similar challenges may also be experienced by other essential workers such as supermarket workers or delivery drivers who routinely would not have considered themselves as providing critical services to the public. To prevent the ill effects of moral injury, certain self-care strategies can be adopted by frontline workers. These can be: healthcare workers should seek support from family, friends, spiritual leaders, or colleagues and use their existing support systems as well, to an extent which is possible. Being aware and vigilant about symptoms of moral injury will help healthcare workers to seek informal assistance if symptoms appear. A person should visit a behavioral health professional if he or she is experiencing more serious adverse reactions such as PTSD symptoms, depression, anxiety, or substance abuse. To prevent the onset of symptoms from moral injury, one should indulge himself or herself in positive self-talk as well as manage their both personal and external expectations. With regard to patient care, it may be necessary to temporarily readjust expectations for the self and for the healthcare system in general. People can develop a personal stress management plan that includes exercise, nutrition, sleep, mindfulness, and relaxation.